talk to us a little bit about these before and afters that we're going to see. I think we're seeing the arm first.
Right, so this was that first applicator, the flat one that I was using.
Wow.
This is just with one treatment, and really when you kind of hang your arm in this position, it's really hard to, like, we don't walk around like this obviously, but you can really see the hang of the fat and the weight of it, and then with just one session of CoolSculpting, we can tighten that up, and our arm is in the same position, so we don't have any rotational changes here with the before and after photos.
How many sessions do you usually do?
I typically tell all my patients 2 sessions is the norm. However, if they're very fit and we're treating them and we can get by with one treatment, then we stop there. So it really depends on when they return to see me after 3 months. I'll reassess them and determine how much fat is left over and how our treatment will be adjusted. So this is a male patient that we treated his entire abdomen and waist.
That's incredible.
Yeah, so he got a lot more definition there. And interestingly, his weight was the same. So sometimes it's a matter of getting rid of what is drawing your attention and grabbing focus as opposed to overall weight loss. So we can help with that with the CoolSculpting.
That's fantastic. Now we want to talk about the surgical options. And what are some of the surgical options available? As we said, we mentioned that we can do them pretty much anywhere except like be under the knee, and that's fine. So what are some that are very common to do?
Well, primarily liposuction, and if we're treating just fat or primarily fat, liposuction is going to be the procedure. So, you know, always with accumulation of fat, there will be a little expansion of the skin. When we perform liposuction, or even with CoolSculpting or the Kybella, which we mentioned earlier, there will always be some degree of skin contraction to improve the contour so we don't have that leftover skin excess. So
we do have a graphic showing us, Dr. Polo, if you can explain this to us and to our viewers at home. What are we looking at?
Well, this is just showing the reduction of the fat layer.
Okay.
Now, you know, with these non-surgical procedures, we don't expect that we're going to get 100% reduction in the fat within the applicator. We're going to get, usually we tell our patients 25%, correct, Tanya? So those examples we saw before are great examples. CoolSculpting is a great option for mild to moderate amounts of fat accumulation. If a patient needs, in Tanya's opinion or in my assessment, more than 2 treatments with CoolSculpting, they may well be better off having a liposuction procedure.